How's it going, guys? We have a pass level question, pathology for step 1. So a 26-year-old dude fell off his bike, scraped his arm, irrigated with sterile saline, disinfected topical iodine. A few sutures were applied, which were removed a week ago. Vitals normal. Physical exam of the wound shows erythematous skin with regions of fibrin coating. No warmth or tenderness. Patient says the area is sometimes intensely itchy. Mild excoriations adjacent to the wound. Vitals are normal. Light microscopy of a biopsy. The area is shown. So let's just hop through. What's the most likely explanation for findings? Choice A, acute infection, wrong fucking answer. Vitals are normal. Not that it's mandatory you have to have Arai vitals, but we note that they're normal. No warmth or tenderness. So we have some relevant negatives here. Erythematous skin with regions of fibrin coating. It's normal post-operative course. I'll talk about this more as we move through the clip. And there's intensely itchy areas as well. That's also a normal post-operative course. The immune system probably trying to bring blood to the area and immune cells as well. Excoriations, it's a vocabulary word that means scratch marks. Okay, it's also something you got to know for USMLE. So acute infection, in defense of some of you who maybe thought it was the case, eosinophilic means pink, basophilic means purple when we look at this stain here, H&E stain. So you could say, oh, well, it does appear that there's a lot of basophilic purple cells, which can be seen in histoslides such as pyelonephritis, prostatitis. They'll just tell you a dude has CVA tenderness, fever of 103, and biopsy shows you just all these purple cells, and that's pyelonephritis, okay? So you say, well, it does appear that there are basophilic cells here. True, but as we just went through the vignette, it doesn't seem that there's infection overtly. And number two is we have lots of RBCs within this slide here, so that there's a better answer. It's not an outrageous answer choice, acute infection, but it's the wrong fucking answer. Choice A, wrong fucking answer. Choice B, allergy, wrong fucking answer. Okay, so I said it's intensely itchy. The flagrant asshole here. Okay, you say, oh, maybe allergy, the topical iodine that was used for disinfection. Okay, just it's normal post-operative course. The way allergy will apply for surgical type interventions, mainly 2CK step 3 questions, they'll give you a 15-line bullshit paragraph. You have no idea what's going on. They'll give you lab values and they'll say eosinophils 9%, eosinophils 15%. They should be under 5%, and that's just allergy. Okay, it's usually a drug allergy of some kind. Students will often memorize post-operative course, certain number of days correlating to a certain post-op pathology. It's not what you want to memorize, okay? Resources that push number of days with pathology is wrong. It's just high eosinophils for those vignettes as I mentioned. Choice B, wrong fucking answer. Choice C, hidradenitis suppurativa, wrong fucking answer. So for those of you who don't know what's going on, you choose weird sounding shit. This is apocrine gland blockage, classically of the axilla and groin, and will appear grossly as a nodulocystic acne type appearance in those regions, and it's idiopathic. And after conservative measures such as good hygiene are executed, USMLE wants you to know that excision of the apocrine tissue is the answer. Okay, that's what they'll have. They'll just show you an axilla, someone's armpit, and it appears like there's bad acne there. You're like, that's weird. That looks like acne of someone's armpit. And the answer is just surgical excision of apocrine tissue. And it's hidradenitis suppurativa. Choice C, wrong fucking answer. Choice D, granulation tissue, correct answer. We have normal post-operative course. Granulation tissue is highly vascular. We have new tissue capillary beds forming. Rich in vascularity is what we're looking at, the slide here. Very buzzy for granulation tissue. NBME will show it to you. So early post-op wound healing, erythematous pink in color due to the granulation tissue, and high in type 3 collagen. Over time, the erythema will decrease as the capillaries abate, and we'll have replacement with type 1 collagen, which is higher in tensile strength. 80% of tensile strength can be achieved normally with wound healing. So it's normal post-operative course, and we ran through the other findings, which are also normal. So just a very buzzy image. You got to know that early wound healing, highly vascular, normal pink tissue, type 3 collagen, granulation, okay? Choice E, granuloma, wrong fucking answer. Obviously just a distractor when it's adjacent. So granuloma in this case could refer to suture granuloma if there's a piece of suture material that's left over as artifact, and you're going to have macrophages coalesce around it, interact with T cells. So they can show you an image and you say, no idea what I'm fucking looking at. but it appears maybe that there's a grayish foreign body in the image, if I had to guess slash hallucinate. And it's like, that's correct, it's a suture granuloma. And they'll tell you in the vignette, which is completely different. They'll say, a guy had surgery 2 months ago, and at the old suture site, there's a nodule or a bump. And biopsy will show you the foreign body. That's a suture granuloma, okay? It's more of a macroscopic appearing granuloma because of that large foreign body, not to be confused with more microscopic granulomas, non-caseating sarcoidosis, Crohn's disease, caseating, TB, fungal infections. Granuloma? Wrong fucking answer. You know the deal. To make more content, click and subscribe to my channel. Appreciate your time. That's it.